Hi and welcome. I'm trying to learn medicine. Today, torn knee cartilage. And after we've done it, we're going to do neck stretching. And if you participate in the neck stretching, then it's at your own risk. And we're talking about internal anatomy, injuries, illness. And there's also no medical advice. We're just learning about it. Torn cartilage, but it's all the time about the knee. But I haven't read it. I have just read the first words. A knee injury in which a sudden twisting movement tears one of the cartilages. And the cartilages are two firm elastic shock absorbers that lie between the ends of the bones in the knee joint. Okay, there is the knee joint, and there are the bones, and there are the bone, and at the top of them there are the cartilages. And they are there to absorb the pressure. Okay. And now through two sudden twisting movement, these cartilages can get a break, get a tear. The tear is commonly sustained by sportsmen or sportspeople, sportswomen, particularly footballers, people who work in a squatting position, for example, miners. I don't know if I've seen coal miners working in a squatting position. Whatever, people who do a lot of work with the knees can get it. Symptoms: pain in the knee following an abrupt twist of a joint. Okay, it's pretty easy to recognize. But maybe not. Maybe the patients don't have. Okay, after a sudden movement there's pain in the knee, swelling of the knee, sometimes locking of the knee so that it cannot straighten fully. Causes twisting of the knee when the joint is bent and the lower leg is flexible. Twisting of the knee when the joint is bent and the lower leg is fixed firmly on the ground. And then turning. So the leg is twisted, is firmly on the ground. The joint is bent and then the leg is turned. Yeah, maybe if I would do it now, a lot of pressure. It's not a nice thing. Duration. Unless the torn cartilage is removed, the knee is susceptible to further disabling injuries. It gets worse on. The torn cartilage has to be removed, and the cartilage doesn't really grow back. The knee is susceptible to further disabling injuries if it is not removed. Treatment in the home. Keep weight off the affected knee, so don't walk anymore and don't stand anymore. When to consult the doctor? Immediately. Symptoms develop. I have to have some real cases. Because this sounds really serious. And now if it is that serious, I want to know how easy it happens. So I want to have some real cases. When to consult the doctor? Immediately. What the doctor might do: advise resting the knee, yes. Refer the patient to hospital for operation to remove the top. Yeah, what happens when the cartilage can't be just removed? Okay, but this is advice to hospital to remove the torn cartilage. Outlook: the knee generally recovers satisfactorily. Why? If a cartilage is removed, how does it heal again? Okay, whatever. They're saying it's not that bad, it goes back, but with a sportsman, woman, people, person, ability may be affected by it. Okay, it's not clear from that how serious of an injury that is now. If it is a little affected, or it is you can't run with anymore. With it. You can walk again, but not running. Or is it just, yes, you can even run really more, but just 100% professional athletic sport is a bit problematic. There's a big margin between not completely 100% athletic sport and you can walk a little. There's a big difference. Outlook: 10 to 20 years after the injury, osteoarthritis may develop in the knee. Why? This is basically the follow-up question to why does it heal at all? Okay. Torn cartilage. I think the useful information of them actually is used, but this is not medical advice. If there is a sudden movement on the knee, then the cartilage can tear, and that is pretty problematic. Don't do it anymore, consult a doctor, maybe surgery. It should go satisfactorily back your ability to walk around, but it can make further problems, and also osteoarthritis is more likely. Now that was the torn knee cartilage part. If we were here for medicine, we could go directly to the next part of medicine. We will do now the Neckstretching. If you participate in the Neckstretching management at the arm risk, go to the same side, and we're doing the hydro tower. Breathe in, lift the arms up, and reach the fingertips as far away as you can. Reach as high as you can, and again back down. Reach as far as you can with the fingertips, and another round. Reach as far as you can with the fingertips. Again down. Reach at the stay. And now a circle. Reach again and from as far as you can with the fingertips. And reach high with the fingertips, and not just to the sides but also back. Reach as far as you can. Reach down as far as you can. And another circle. Reach as far as you can with the fingertips. Now the buzzer. Feet are standing together, arms up to a T, and pretend to fly. And next exercise for police officer. Feet are standing together, pretend lift the arms up. And breathe out, open the arms to one side. Breathe in, lift the arms up. And out, over to the other side. Again, in the arms up. And out and down. Now, legs are standing shoulders wide apart, tall up, shoulders back. Breathe in. And out, bring the head over to one side. Breathe again in. And out the head down to the clavicle, so chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head over to the other side. Still tall up, shoulders back, breathe out. And bring the chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head back into the middle. And out the way upside directly. And the chin down to the clavicle. Breathe again in. And breathe halfway out. And bring the head over to the other side in a circle movement. Breathe again in. Breathe halfway out. And bring the head in a circulatory movement out to the other side. And back in the middle. Now with feet standing together. Breathe in, lift the arms up, the crab in the morning. And breathe out, lean back, open the chest to the sky, draw the shoulder blades together. Again, in the arms up. Out the arms down and draw the shoulder blades together. Again, in the arms up. Hands together, breathe out, lean back, the lead in the wind. In. And out and again back. Again, in into the middle. And out of the other side, the final wind. Again in. And out to the other side. Again in. Across the arms and just the fingers and reach high, the screw. And breathe out, reach in front, all over back. The drill. Again in the arms up. And out and down again, we grip in the morning, draw the shoulder blades together. Again in. Lift the arms, the ring fingers each high, the screw. Breathe out in front of the drill, all over back. Again in and up. And out and down. And now, bring the hands together and also the elbows. Pull up. And bring the hands up as far as you can come with moderate effort. And again down. And another time. And again down. And now, the pressure-based nailer machine exercise. We are taking fingers together. Yes, this way is also possible. Together. And now reach in front as far as you can. Bend your head down and reach as far in front as you can. Breathe out. Again, in, come up. And breathe out, again in front, head down to the front. Again, up and up. And now the cashew. The feet are standing together. And front the fingers behind the back. Turn up, shoulders back. Breathe in. And out, bring the head out to one side and the chin down to the clavicle. Breathe again in. And out and stretch with the hands down to the floor. Again in, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin onto the clavicle and pull the hands down to the ground. Again in, up, back into the middle. And last full proper exercise, a stretch of Venus. Intertwine the fingers, bring the hands over to one side. Turn up, breathe in. Shoulders back and turn the head over to the side with the hands up. Breathe again in. And out, chin down to the clavicle and pull the arm in and the shoulder down. Again in, lift the gaze, turn the head over to the other side, arms also over to the other side. Turn up, breathe in. And out, chin down to the clavicle, pull the arm in and the shoulder down. Breathe again in, lift the gaze, and bring the head back into the middle. And now sky hugger, feet are standing together, breathe and lift the arms up. Breathe out, lean back, hop just to the sky, long arms, again in the arms up. And out and down, again up, out and down. And now the eagle's wings, breathe and lift the arms up. Breathe out the arms down. In the arms up, now the arms down, and the last movement, the cactus connecting its stings, breathe into the arms up, bring the hands to touch and lower the hands slowly down to heart center. That was the next stretching. Thank you very much and until the next time.